Welcome to In Moderation,
the show where we give you a moderate dose of info, sarcasm, and we already know we're not approved.
Hey everybody, welcome to episode 70, because I remember
What?
69 was last week. 69 was last week, you
69 was
remember?
last 2 months.
No, it was last week, I specifically remember. Welcome to episode 70 of In Moderation. We have 2 guests on this week. Last week we had 0. Wait, do we know? Last week we had 1?
Yeah.
Was
no,
it
last
2
week
weeks
we had-
ago?
Wait, what? No. Yes.
What happened?
Last week.
Yes.
Last week. Well, last week was. No, wait.
Wait, was last week Hope, and then the week before that was just us? Whatever it was.
It was Hope and then us.
Hope and then us. Okay, so last week, we'll cut all that in editing. Last week, it was two of us, so we had to bring on 2 guests to make up for it. So tonight, I want to make sure. We have Dr. Mike, and how do I pronounce this? Tates?
Tate, yeah.
Tate.
That was actually my best friend. We used to work together at a chiropractic clinic, and we were both assistant. And Tatiana was like too much ta-ta-ta. And she would go like, Tates. So I just stayed like that.
Oh,
Yeah.
I like it.
Yeah.
Tate, break this guy's bone. Tate, crack that neck. Tate.
Nope.
Tatiana. I like it. I mean, I'm a whole bunch of things according to people on the internet. None of them good. But why don't we like to hand it over to our guests because we're not good at introducing people. So we're going to let you 2 do the introduction. Just tell us a little bit about yourselves.
You already started. You want to go first?
Sure, I can start. So I'm Dr. Tate, or Tatiana, but we're both from Puerto Rico. I started as a massage therapist in Puerto Rico, and then when I moved to the US, I did athletic training, and then I moved to chiropractic, and I specialize a lot in sports, but I just love working with a lot of active people and just being simple, helping them keep that active lifestyle. But besides from that, we are super simple people. We just enjoy life, going on hikes, going to the beach, just doing adventures, tasting really good foods and just learning. So.
Oh, yeah. Especially if it's filled with seed oils. That's my favorite.
Regardless of the ingredients.
Yeah.
They know which podcast they're on. Super simple works very well on this podcast.
Yeah.
If you said complicated, I'd be like, we're in trouble. What about you, Mike? What do you give us a little bit about yourself?
So I started as biology major. For the longest time, I kind of wanted to be an orthopedic surgeon. And then I don't think it was like 11th, 12th grade, I kind of switched to chiropractic. But it was this specific chiropractor back home, which I don't know where he is. I don't know if he died. I've been willing to just say thanks.
I don't know if he died. Like, I don't know if he's still around.
Dude, I try to find his license to try to just call him and just say, hey, thank you for giving me the last push. I don't know where he is. But if he's watching Dr. Davila, you're awesome. So this was like the first. I've always gone to chiropractors, but I've never had someone be very detailed and like work with different physicians. I always thought they were like, they're another massage therapist with cracking bones license, whatever.
Massage therapist for your bones.
Yeah.
That's what I thought. Like what the hell is this? But he was very detailed and he worked with some of the nearby orthopedic doctors and primary care physicians. So I was like, this is awesome. I like this. So he gave me the last push, went to chiropractic school, graduated a couple of years ago, and then got into massive identity crisis because for the longest time. Yeah. So to give a little backstory so people understand how going inside chiropractic works, very similar to med school. There's like branches of like specialties you can do. Like if you go, you can be like internal medicine doctor, or if you want to do the extra years, you can be a neurosurgeon. Or whatever you want to do.
Quack, you can go down the quack.
Exactly. Because I was going to ask you about it because all I've learned from chiropractors on social media is that seed oils and aspartame is horrible for me. That's pretty much the extent of what I've learned from social media chiropractors.
That's why we're here. That's the main thing. To completely destroy 85% of the profession.
And we actually did believe that for a moment. Like, I would be one of those reading the ingredients, be like, oh, this has.
I think we all
this has gum, so I can't eat this.
Bit like that until you go into like the research, which was my initial thing. For the longest time, I was kind of bashing with a lot of my colleagues. I was like, but this makes no sense. Why would you do that? And I've always wanted to go into the rehabilitation in neurology, so more like balance stuff, vertigo, all that stuff. Once I graduated, I started module 1. Fucking hated it with my life.
Wait, you started module 1 after graduating? Shouldn't you have started module 1 before?
I should have done module 1 because that postdoctorate diploma, you can start it as a student. But I was like, it's too much work. I'll wait until graduation. I'll have more time. Took module 1, hated it, got into this massive identity crisis, and that's where I stumbled by her. She said, you've always been interested in functional medicine and nutrition and all the chemistry stuff. Why don't you just like look that up and see? You can do stuff like that. So I went into this massive rabbit hole, and here I am.
The funniest part is that when we first met, he was the type of guy that he wouldn't eat anything. He would just eat like mac and cheese, eggs, bread, soda. He would go to Cece's Pizza, all that.
Put some maple syrup on that.
Yeah,
you're Canadian.
Yeah. So when he met me, I used to be a vegetarian for 14 years, and then I stopped doing it. So I learned how to cook a lot of vegetables and integrate all of that to my foods. And I started to teach him. And all of a sudden, he became this guru of food. I'm like, what the heck?
So that's a little bit about us, roughly. Yeah. And I like to play aggressive video games a lot.
Not regular videos, aggressive. I like
aggressive.
Yeah.
The ones that you scream, those ones.
Yeah.
I mean, to be fair, any game you can scream if you're, suck at it.
I guess you could, but if you're playing like Hello Kitty Island Adventure and like you're screaming at that, that's a problem. Like you need to see someone besides a chiropractor for that.
Well, according to chiropractors, you'd want to see a chiropractor for that.
I mean,
for 6 months, by the way.
Yeah. We can help your mood disorder, just to see one adjustment and you're good.
Can you tell me, can you give me a little, because I don't think most people really know, and I don't really know, like, what's the purpose of chiropractic medicine? So you said there's like different paths you can take. Like, kind of give us a general, like, I don't know, just like, what are most chiropractors doing? Like, I'm talking dumb this down, like real low. All right, just pure basics.
Talk to Liam like he is a 5th grader.
Yeah. Do you want
Talk to me like I am.
Do you want me to do it, or you want you to do it?
However, yeah.
So the most dumbed way and more easiest way to understand, according to the World Health Organization, which was updated a year ago, which is the most recent evidence we have about what the manipulation do, because we can go into a tangent in that, is another pain management tool for non-surgical procedures. So it increases a little bit of the range of motion temporarily. So it facilitates the movement for an exercise. So a lot of people, when they get adjusted, like, oh my God, I feel so much better. And they start moving, they start doing all their stuff. They got better by the movement they were doing, not by the adjustment. That is the big mistake you will hear with like chiropractors every time.
I mean, that's everything on like, shows. Like, you see a TV show, they just like, oh, come here. And then they're like, oh, now I feel so much better. So it's not that's really doing it. That helps you feel better in order to do the movement. That helps you actually feel better.
Yeah, because what it does is increases your range of motion and then decreases the pain. But how it decreases the pain is because there's a release of endorphins. But that is a short-term type of thing. So after you do that adjustment, the most important thing is going to be to target with other therapies. It can be exercises, manual therapies, and all that. But that's the real magic. So it's example, like you come in, you have low back pain, and I tell you, oh, we're going to do all these exercises right now. You're going to be like, heck no, like I'm in pain. So we use that adjustment to be able to decrease the pain, increase the range of motion. That way you feel better, you're happier. And now we can do those other exercises. So that's the real magic. But, you know, they overcomplicate it.
Finally, somebody made chiropractors make sense.
That's what that's for the purpose of, for me, at this podcast, is just like, what is actually going on?
That is like the physiological. If you want to go into like the nitty gritty, essentially, when you have a little crack, that afferent signal goes into the brain, then goes back into that specific area as an efferent signal, and just sends a small endorphin reaction. So that's why you feel like, oh my god, I feel so much better. But that's like the only peptide that they have found that actually releases. Like, there's a little bit of serotonin and dopamine because you kind of feel less pain, so you kind of feel a little bit better, so your mood is a little bit better.
Right.
But there's like no concrete evidence like this is what happens.
Yeah.
Okay.
Roughly that is like the whole adjustment thingy.
Yeah. So there's like a really misconception, and this comes from way back from when chiropractic started. And there's actually a chart of where those nerves go to, like what organs and everything, like what they're connected. And still chiropractors use it. It's like, oh, if I adjust your T2, I'm gonna, be affecting this specific organ. No, that's not happening. No, there's no evidence for that. You're just increasing range of motion, decreasing pain. That's about it.
We're gonna have to complicate it that much.
Yeah. Like, I'm not gonna cure asthma. I'm not gonna cure your GI issues. No.
Yes, that's why I see a lot from chiropractors, is it all comes back to these adjustpents, right? Like all these different disease states or whatever, it just all comes back. If I do this, it relieves that.
I haven't heard that in a while. The disease state.
I see that. Like, that's what I stop. Like, well, this is a disease state, and big pharma isn't treating the actual underlying cause. I release your whatever. I don't know. Like, just
yeah.
When I hear chiropractors saying that we are nervous system doctors, I have a friend. Like, we have a friend in common.
Mm-hmm.
He did his diplomate in clinical neurology. He has a master's in neuroscience, and he's like, that's not how it works.
Yeah, it's BS.
Like, that's bullshit. Like, that's not it. Like, we're not nervous system doctors.
Yeah,
like,
we're musculoskeletal doctors.
So bone massagers really wasn't that far off the mark.
No.
So you said there's different like subspecialties then, right? Like that you kind of go into different fields. Like, what are you in? And then like kind of a general, like what is some of the most common ones, I guess?
I'd say the whole community is gonna hate me right now, but that's why I exist. So there's multiple branches you can take. The ones that genuinely are good, that make sense going into it's sports chiropractic, which is essentially same level as a physical therapist. Radiology, so a chiropractor can actually go into the same residency program as a radiologist. It's a 3-year program, so it's same as med school, and you are a certified chiropractic radiologist, so you could have the same exact job as a medical radiologist. That is, for me, that's a really good one. And it's the hardest one to get in. It's the hardest one to pass. It's the hardest one to maintain. Makes sense because you're essentially reading radiographs, MRIs. You're essentially the first
So what
line
makes
of
them
defense.
different though than a radiologist? Like, what's the difference between going the chiropractic route, I guess?
I would say probably it's a little bit shorter time because for med school will be way longer, that's for sure. This one will be a little bit of a shorter time because if you want to be a radiologist, you can do the chiropractic route, which is probably like 3.5 years, 4 years, depending what school you go. And then the diplomate program, residency program is 3 years. And you have to take 2 board exams to just even pass and become a radiologist. That is the one that is top notch. But not a lot of people do it because obviously if you're a radiologist, you're not going to be practicing at all because you're in a dark room reading like a normal radiologist.
Well, so I'm just assuming that this chiropractic radiologist is going into the room and just being like, okay, give me a second. I need to dislocate your spine so we can get a good picture of this.
Nah. All the I personally know two chiropractor radiologists. One of them actually is a faculty member in oh my god, National University Health Science University. he's a head of radiology. He teaches anything radiology. And the other one, he works in multiple hospitals. So, you know, it's a really, really detailed program. I would say that is like the most profound.
Right, so we got sports chiropractic medicine, and then we got radiology chiropractic medicine.
And then
what else we got?
The functional medicine is really good, and the neurology.
It's clinical nutrition.
Oh, never mind.
Clinical nutrition.
But I'm a little iffy with that one because the ACA, so the American Chiropractic Association, they have a branch of nutrition, which is the American Board of Chiropractic Nutrition. But the one that I'm talking about is the American Board of Clinical Nutrition, which is the one that MDs, DOs, anyone that is a healthcare can actually take that exam. That is the route you can't take. And then the other one will be neurology.
Yeah, and that one is really good for people that work with more neurological type of symptoms, or people that have like concussions, vertigos, all that stuff. So it is really good, but it's a hefty one too.
Yeah, I say the most difficult ones is radiology.
Radiology.
And I would put side by side the clinical nutrition and the neurology because I spoke, because the whole goal that I'm going through is to become a dietitian. That's like the end goal. And I was talking to oh my god, one of the president of the school that I'm going, and he is a licensed registered dietitian, and he has also that exam, the diplomate in clinical nutrition. I'm like, be honest, which one's more difficult? And he was like, the clinical nutrition board is like twice as hard as the registered dietitian license. I was like, oh my god, okay.
Yeah.
So that's what I'm expecting to die.
There's other ones. There's like, you know, pediatrics,
which is BS, by the way.
Can I ask about, because like I've seen some videos of like adjusting like children and like babies, and just alarms just go off immediately in my head.
So every time a patient asks me, "Can I bring my kid so you can adjust it?" I'm like, "Does he have an issue?" No, right? Why? Because if we go back to the basics, the adjustment increases range of motion, decreases pain. Kids have a lot of range of motion. They're gummy.
Yeah, they're growing.
Yeah. Why do I want to adjust them? Unless there's like an actual issue.
Hell, like a kid athlete.
Yeah.
You know, I've treated
and not even
athletes.
that. Even if I get a kid that is an athlete, I just do rehab. I don't even do the adjustment.
Okay.
Which is a no-no in chiropractic world. If you don't adjust someone, you're not a chiropractor.
Yeah. But going back, I'm a sports chiro. So I focus more in the rehab.
Because like, especially for a child, like, I mean, correct me if I'm wrong here, but like an adjustment could go really wrong. Like if you don't know what you're doing.
Severely wrong.
Yeah. So like people say like, oh, you have a bone out of place. Oh, we're putting the spine back into alignment.
That's the stuff I hear. And then like I see them with a skeleton and they fold them in half. Yeah. Like that's the stuff I see.
So if you have a bone out of place, I'm not going to touch you. I'm sending you to the hospital because
if you have a bone out of place, I'm using my CPR license to call 911.
And the other thing is that the spine is actually so stable. You have all the ligaments, you have the disc, you're not moving anything. You have so many stuff. You're not moving anything back into place.
If you were that fragile, football players will die when they get tackled.
Yeah.
It's just common sense.
Yeah. Look how much effort it takes just to crack your ribs, and those are just tiny little things floating there.
Oh, yeah.
Mm-hmm. Yeah.
So yeah, no, the pediatrics, up to this day, there's absolutely no evidence, because this is the major. I'm gonna debunk the whole chiropractic pediatric profession. A lot are gonna hate me. I don't really care. The whole thing with
people hating you is why people go on this podcast. It's just piss off others. That's pretty much the goal.
like, dude, this is what happens. So most of the pediatric chiropractors will say like, oh, I help like kids with colic, and this is how, because I can talk about this because I worked with someone that had a lot of pediatric experience, so I can speak pretty heavily about this. So the whole thing is they will do like a 12 visit, like a 12-week plan, right? And they'll like adjust the kid and like do like some like basic movement stuff, blah blah blah. But you know what's the fun, and the colic will go away. You know what the research says? How long does it take for colic to go on its own? 12 weeks. So
right.
So was it the chiropractor, or was it just the baby?
Just the waiting. I like that. I love the history of medicine and like the old timey like nonsense with the guy with a little doctor bag that had stuff that just made you pee and poop and stuff like that. And a lot of the old timey like cures were always just like, hey, do this and wait a month. It would be like, oh, how do I know if I'm pregnant? Well, okay, sit in a bath filled with yogurt and then wait 3 weeks, and if you don't get your period, you're pregnant. And it's like, well, you didn't have to sit in the bath with the yogurt. You could have just waited. Like, those are the best, because you can just tell them to do anything and then they'll be like, oh, it worked.
Yeah.
I love it.
Yep, that's pretty much.
Yeah, so pediatric, not so. I kind of suspected that, and I feel like a part of that is where like some chiropractors get a bad name is for the with the stuff with the adjusting children and stuff. Just immediately you just see like anybody, you just see it. You're just like, that's I can't imagine that is good.
Yeah. I remember there was this video. He makes fun of me when I say video. He says you have such perfect English until you say video. I feel I'm saying normal.
We'll go back and we'll hear that little. We'll make a little meme about it.
I was born and raised here. I still say Reese's and people make fun of me, so we all have those words. It's fine.
So there was this doctor that Michael actually really liked and he admired and everything, and he posted this about this child was crying.
I think Dr. It's actually covered him. Actually,
yeah, I
think so.
Yeah, the child was literally crying, and he adjusted the child. Like, why are you doing that? First of all, the kid is scared. It's crying. He's gonna tense up. So you're fighting against all these muscles. You're just gonna strain the kid. Like, why? What's the necessity?
Worse. Like, that just seems...
You're going to traumatize that poor kid.
Okay. So...
Yeah. So, no, please don't.
Okay. Well, okay, so what we really need to get into is why is it that chiropractors feel the need to go, let's say, out of their lane a little bit? What is
That's what I was going to say about the clinical nutritionist stuff, is that you basically went, you know what? There's this other lane here. And instead of just swerving out of it and being all over the place, I'm going to learn how that lane works, and then I can be in it.
Yeah. No, but it's like it's a lot of like, what is it about, it's just like, is it just the people that like chiropractic medicine attracts, or is it something about it specifically that causes chiropractors go, no, I'm going to teach people about the dangers of canola oil? Like, what's going on there?
I feel it's a 50-50. It's a lot of people that the profession attracts. They have that type of vibe and mentality. Other thing is the outdated data that we are taught in school.
Okay.
And people just stay with whatever is taught in school instead of looking for new research.
I think it also depends heavily on... So the first 2 years of chiropractic, you're essentially very heavy on the theory, on the therapies, manipulating, exercise. So the first year is pure theory. Like, you're like all the sciences, nutrition, neurology, everything. Then second year is more into the clinical side, so you're doing more of the therapies, manual therapies, passive, active, everything. And then your last year, you're in the clinic, so you're generally treating patients under someone's license. Same, very similar to medical school.
Okay.
It really, I think the turning point is who is your clinic doctor.
Yeah.
Who is your supervisor? Because there's a lot of supervising clinicians who genuinely suck butt cheeks. They're like, I don't know how you're still practicing, my dude.
Yeah.
But like we because you can choose who you want to go. Like it's not like it's rocket science, right? We chose very specific people that they are very broad and they're like heavy in the evidence. Like my clinician, like he will have a case that's a little complicated, and it was like, well, let's go to PubMed, and we'll be in his office for a whole hour just reading articles. Like, okay, what will be the best course of action for X patient? And he will subtract points if I didn't which now I'm seeing it because now I'm a professor, but he will like subtract like points of like, you didn't do proper APA citation. That is not correct, Mike. I'm like, you. Now I'm the one doing that. Anyways, but I think it really, really depends on who is your clinic doctor, because if you have someone that genuinely cares, generally, because in Florida, our title is chiropractic physician. We have a pretty big scope in Florida. Like we can do blood labs, we can do nutrition, we can do exercise, we can order any type of imaging, we can do a lot of stuff. The only things we can't do is obviously prescription drugs, because we have no training. We take 6 credits in pharmacology, and that's like basic understanding.
Right, basics,
like, very basic.
I think I have like 6 credits in like pharmacology from my time. Yeah,
it's like like ibuprofen. Like it's not heavy, and we can even do phlebotomy in Florida, so we can do. We have our license lets us do a lot of stuff. So I think a lot of people, they just stay with like the basics instead of like, you got a lot of education from the school. Why are you gonna use one thing out of so many therapies and treatments that we learn? It's not like it's not like we don't learn it. Like for us to even practice in any state, we have to take a physical therapy board exam. It's not like it's not optional, denied.
Yeah, it's like they just hide it in the back of their head, like, I don't need that information. I'll just go with
like, I'm not going to work this muscle because I'm not a real chiropractor if I do that. I'm like, what?
Actually, we have in chiropractic, there's something called the Green Book.
Wow.
That is like the basic philosophical book that was written, the 1918, something like that, 1920?
No. 1915, something like that.
I feel it's like the 1500s, honestly. And it's such an old book, and it's all philosophical, and it's so mind-blowing how students nowadays, or even professionals, they still practice by that book. It's like me taking a medical book from the medieval age. Like, why?
So yeah, is it kind of that like chiropractors are kind of drawn like you said, they kind of get stuck in older ways? Well, like I don't
this entire thing is finally making me understand the wellness way.
The wellness way, I was going to bring them up. Yeah, because they're
for those who don't know. They're a group of chiropractors that like, it's essentially a chiropractor MLM. There's this one guy at the top of it, and he trains the people under them, and they train the people under them. And so this ancient chiropractic technique guy is passing on a whole bunch of stuff, and they're just kind of spreading out, and it entirely makes sense with what they've just told us.
Yeah.
Yep, it's tricky. That's why we went into a massive identity crisis when we opened up a year ago. We're like, I don't want to.
Yeah.
Someone comes with toe pain, I'm going to tell them, you need 6 months. Like, why?
Yeah.
I don't have the face to just tell them, you need 6 months of the same exact treatment for 6 months.
Yeah. And it's this idea.
You have integrity. Uh-oh.
And it's this idea that we had when we were in school, and once you come out, you're hit with reality that all of these teachings make no sense. And like, especially for me, that I'm an athletic trainer, like I saw the value of rehab and how well it worked with not even adjusting one single bone. And I was like, why am I doing this? But at the same time, it's another tool in my toolbox.
Oh,
Yeah.
uh-oh.
Oh.
Oakley must have woke up. He's probably got to get her.
that moment.
Yeah.
Yep.
But yeah, that is essentially like the main thing.
We kind of lost our train of thought with Liam suddenly just getting up and vamoosing.
Like, we'll just
I can't take all this talk about chiropractic. I just gotta go.
Yeah. Yeah. But and after I got that identity crisis, I actually I
is
realized
the daughter okay, Liam?
Yeah.
It was my dogs, actually. I kept just hearing whining over and over. I'm like, what is going on out there? Go out, whatever. Jesus, I have 4 of them, so there's always one that has a problem. And if it's not one of them, it's my dog. They're killing rats outside. Like, they're chasing things down. They're hurting themselves. Oh, they're so dumb. Why are animals supposed to be so dumb? Gosh, they're like
okay, but are they more or less dumb?
Dumber than the wellness way people, which is I already thought of that, Rob. Like, don't get me wrong, like well people are dumb, but like my dogs are so
the
fucking
store
dumb.
half naked.
Oh my gosh, yeah. I tell you. Okay, so here, can I ask you guys, who's your favorite pseudoscience chiropractor then? Is it Dr. Berg? Do you like the wellness way people? Like, where are you guys at with that?
Let's see.
It's a tough choice. There's so many. That's the
I
problem.
There are so many.
There's so many bad ones that I just ignore it, and I just unfollow. I scroll. I'm like, no, don't want to see that.
I think I'm the only one that kind of gets. There's a lot that I think I would say, what the fuck are you talking about? But I don't think I have a favorite because they kind of like fight for the top.
Who's the worst?
I think the ones that
can only be one.
Can only be one.
Oh, I will say, okay, the Rindinger.
Who's this now?
Oh my god. Okay, so there's this device that did he invented that? Maybe. I don't know if he invented it. It's like a strap that you put around your neck. It has a long lever. And
okay, I love it already.
It's a medieval torture device.
They tie your feet on the table.
Good.
And they take that long
because
lever.
Why wouldn't they?
Right. And they pull your head.
Have you seen those videos?
So you get the distraction.
Yank them like that. Have you seen those?
Oh,
and there's some people that.
Oh, that.
Yeah.
I love how Rob went into
immediately up, like I need to order this off Amazon.
And some people, they do it so aggressively that the patient flies off the table. It's like, first of all, what's the necessity?
Your face is cold.
When when you're tying the feet, there's nowhere.
Wait, how do they fly
go.
off the table if their feet are tied?
No, the patient literally just yanks.
So they don't. So, okay, I'm trying to understand this here. This is very important. So the feet are either tied together or they're tied to the table, or like they're tied to something. Or
no. So there's some patients that they have their feet tied, but there are others that don't have it tied and they fly off. The thing is that when the feet are tied and you do that aggressive pull, there's been people that they get like an avulsion fracture, like it chips off a little bit from the spine.
So how much taller will I get from
lovely,
this?
The GIF that showed up.
And that's with a towel, but there's an actual device. And every time a patient comes to me,
this guy's a scrub. He's got a towel. Like you need to get the real device, bro. You can't just be using a towel.
Patients come to me and they're like, "Oh, can you do that yanking the Rindinger?" I'm like, "Absolutely not. No." You don't need that.
Okay.
That's so.
See,
Oh, it's so dangerous.
Because that's the stuff I see. I'm like, oh, that's chiropractic medicine right there. Like, because that's what's going to go viral, right? Like, I feel like that's the stuff that people are going to see.
If it doesn't look explosive, it's like who wants to see a chiropractor telling the patient you need to do this type of exercise, because it's like no one really cares.
Yeah, if you give patient exercises, they're gonna get better way too fast. They're not going to come back.
You want to keep... Okay. You know what's funny? Because I feel like it's the chiropractors that are always like, big pharma makes you coming back. But I feel like then they just kind of say, like, see me every week for $1,000. Like, you know...
Right?
Like,
listen, if we are both cancer survivors, if big pharma didn't exist, we would have
been dead. Yeah.
We wouldn't be doing this podcast.
There's always a time.
Wait, you guys couldn't do the adjustment to relieve the cancer organ or whatever?
Yeah, you could have like adjusted each other. You don't just grab each other.
Yeah.
There's this guy in Colombia. He can't practice in the United States because he, as a student, got into a massive ethical violation with the school and the board, so he can't practice in the United States. But he moved to Colombia because he speaks Spanish, and he posted on Facebook. You remember this, right?
Yeah.
He posted that he has a patient with thyroid cancer, malignant thyroid cancer, not a benign cancer, malignant. And he told her that if she wanted to like elevate her life and feel better, she needed to buy his care plan and not go the chemotherapy and removal of the mass.
Oh my God.
That's the stuff I feel
Facebook.
like
that's the kind of thing that killed
really
Steve
pissed me off. Yeah, that really pissed me off.
Because
there's
I don't really want to.
There's a very high chance that person might not make it, and that really pisses me off. Not even as a doctor, as a person. It's why?
What I'm kind of curious. Like, it seems like a lot common, I guess I'd say, or more, maybe just more common in like chiropractic medicine, that there's a distrust of, I don't know, the status quo. Maybe I'll put it like whatever standard, like, you know, the big pharma, the like this sort of stuff. Like, there's more. It seems to be more of that, or it seems to be at least a decent amount of that in chiropractic medicine, where they say, you know, what you've been told is wrong. I don't know.
Yeah, that actually goes way back, because when chiropractic started, people were starting to get better. And a lot of the medical community didn't like that. So they would start telling patients like, oh, don't go there. It's really dangerous. Like, they're going to do this and this and that. And there was actually a really big lawsuit that chiropractic won. And right now, if someone hears a medical doctor talking shit basically about a chiropractor, they can actually get in trouble because of this lawsuit. Now, I feel that a lot of people stayed with that mindset and in the past, because yes, there was an issue, but you know, it's been so many years, like there's so many advancements, and right now we are actually one of the ones that we work alongside with doctors. Like, every time we have a question, we have a referral, we speak to doctors, and there's always a time and place. There's moments that you're going to need more conservative care. There's moments that you're going to need, you know, see a medical doctor. I have patients that they literally tell me like, oh, I'm so afraid of taking, you know, an ibuprofen. Like, I want to go the natural route. I'm like, don't suffer. If you're on vacation and it hurts, take the ibuprofen. So
I see that a lot from people. I don't want to take whatever it is, a statin to lower my cholesterol. I want to do it the natural way, you know, and I totally understand that. I get that. But like, it seems like a lot of practicing chiropractors will use that to bring them in and say, okay, instead, you know, you do this instead of just saying like.
I think most piggybacking to what you're saying, Liam, a lot of chiropractors, they go and take like a small course in like functional medicine, and for people to kind of know what truly functional medicine is, because there's a huge, we can go into another podcast with how this is another topic, but essentially a lot of people have a bad misconception of what functional medicine is. They think it's just going into the natural route, and there's no use for pharmacological pharmaceutical stuff. The way it works is making sure you are co-managing correctly with the physician if the patient needs a medication, and using either a supplement, an herbal supplement, vitamins, minerals, or food. A lot of people take it completely the other route and they're like, don't do that. How about you just take this herb? That herb probably doesn't have a lot of evidence to support it. That's the big issue that a lot of the schools have. They, yeah, this was proven in India that it worked in Ayurvedic medicine. Cool. It worked for one person, not for like the majority. So how can you replicate
or
that
even
this
better,
works? Go for it.
Even better, they'll be like, take this herb, which, by the way, the medication that you were offered was isolated from that herb so that you didn't have to consume 700 kilograms of the herb to get the proper dose.
No, like
because I'll just be honest. Like whenever I hear I'm Dr. So-and-so and I'm a functional medical, I'm like already like, oh boy, I feel like I'm about to hear some shit right here. Like it's always just something just wild and out there. And then it proceeds to be like big pharma, yada, yada, yada. Or it's just like, but I have seen like, good function people who say like, hey, I'm functional medicine, but it always feels like they have to say, hey, I'm a functional medicine this, but I'm not crazy. Like they have to add that. It's just like a stipulation.
That's me.
Yeah, I mean, that's basically what we do. Like if you see our Instagram, it's always like, yeah, we're not the ones that are going to sell you like a, 20 visit package for 6 months.
No, it's like,
it works alongside, like you said, like it's supposed to, like you work with your doctor. And then also if you want to try these things in addition, that's great. But like it seems like the functional medicine people always push you away from that sort of, don't take that, try this instead.
Like
I always love that from a Canadian perspective, because whenever you Americans and anybody else that doesn't have social care, you say that big pharma is all in this to make you sick and stuff. And it's like, in Canada, that argument doesn't work. The doctors are getting paid the exact same amount, no matter how many times they see you, no matter what they give you.
Yeah, and any country besides America. Literally, I think Dr. Itz gets it all the time. Like that's England, it's any other country. You just look at any of them. They do the same thing happens.
What I've come to understand, particularly from Brendan, is that the problem is more with your insurance companies than it is with big pharma.
Mm-hmm.
No, insurance companies suck ass. Like, dealing with insurance is the worst.
That is one area that we are cash, because if we tend to go insurance, I think I'm not going to name any insurance company, but the highest that you will get paid for a treatment, it will be probably like $35 with the copay and everything. So you would have to see a lot of people to just try to sustain yourself. Mm-hmm. So and they only cover, and this is the funny part, they only cover the adjustment.
Yeah. So
they don't cover any other therapy. So
so that's why you just keep doing adjustments. Yeah. Just get real, just like a circle. Just keep going around.
Because what's the point of spending, the least amount of time we spend with a patient is 30 minutes. Why spend 30 minutes with a patient doing muscle work and exercise and bill a therapeutic exercise code if it's not going to get reimbursed?
That they're only going to pay you $16 for exercises, by the way.
And most of the time they're like, no, they will see the credential, they will see these things like, no, we're not going to cover that.
So that's why a lot of offices, it becomes a rat race, because they're trying to keep up and get money. So they see patients every 5 minutes, because they have to, have this big volume to be able to get the same thing.
Get over here, tie your feet down, give me a towel, get the hell out of here.
And it stops being a doctor, because you're just seeing numbers.
Yeah.
You're just cracking everybody up regardless. And that's where hospital stuff happens. That's when you get, there's not a huge amount of cases of stroke, but the cases that have occurred with cervical dissections, it's because of that, because the assessment is very low.
Do you think chiropractors in other countries then are kind of on the same level as Americans, or is it like American chiropractors tend to be worsen this aspect of trying to, just get adjustments and get paid off it because of the way our insurance system is set up?
I think it's Americans, and if they graduated in the United States and they go abroad, it's still Americans.
Yeah.
because
Got it.
we actually the South Africa patient though that we have.
Oh, yeah.
She had a chiropractor in South Africa, and he was like a physical therapist. Like he will come and see. He will do cupping, he will do grafting, he will do muscle work, he will do exercise, he will like, hey, we need to like help improve your sleep, let's work on some meditation, some relaxation. So it's like a very well rounded. And when she came to America and she went to like a big company, which I'm not gonna name, and she got cracked, and she's like, oh, that's it? It's like, yeah, that's it. And she was like, oh, well, this
It
sucks.
also depends on the country, because there's some places outside the US that they're not doctors. They are seen more like as a massage therapist or a physiotherapist.
In Japan, it's a bachelor's degree.
Yeah. So I think, I might be mistaken, but I think that the US is the only place that we are doctors. I might be wrong, but
yeah, it's because of the scope. Like for example, like I think there's a little bit too freedom with giving chiropractic the title of physician, because a lot of people put like, oh, I'm a physician, and they only do adjustments. Like, well,
are you?
Not really. Not really,
Yeah.
Can you give us more? Any more like your favorite pseudoscience in the chiropractic world? So you got like your towel neck adjustments. You got anything else that you see every time you see? You just kind of like, oh shit.
Yeah. I got the perfect one.
Yeah.
Applied kinesiology.
Oh my god.
Have you ever seen that?
Wow. Oh
I have not. Please inform me. What's this?
So they put you on the table.
Buckle up, buddy.
They start muscle testing you. Let's say that they muscle test you, pushing down your arm, and it goes weak. Then they take a bottle with some supplement, element, or whatever, and they put it in your belly, and then they test again. If it goes strong, it's because you're deficient of that supplement.
Gotcha.
So I have to start giving
take his glasses off.
What about the glass? What about the
This is great.
plastic? What about your body knows what you're going to do, and now it's going to become stronger?
That last one really seems to add up more, but I kind of like the magic, like magnesium deficiency sort of thing. That sounds kind of fun.
Yeah. It's like,
when I saw that, I was like,
that's
what
cool.
are you doing?
and we ask,
and how much do you charge for that?
They charge a lot. It's like expensive.
I'm like, damn, I'm in the wrong side of
right.
I need to
See,
change.
these are the things I want to learn about. Like, I want to, Rob and I are setting up for when we go rogue and we start selling all sorts of bullshit.
Well,
so we want to applied kinesiology. That's pretty good.
Seed oils. You need to do heavy metal toxicity and detox all the time for everything. I keep
getting tagged in this chiropractor saying that this is your spine and it's inflamed when you eat these foods, and then it's all seed oils and artificial sweeteners and like all the classics and stuff like that. I'm like, what kind of and people keep asking like, what do you think about this? I'm like, what do you think I think about this? Like, use a little common sense here.
Dude, I've gotten tagged because I try to not talk crap, but I will go more into like the Spanish speaking ones and be like, no, that's not, because you're doing a lot of the work already. Both of you in the English department. I was like, oh, I'll just switch up to the Spanish and just cover the Spanish part. And I understand the hate now, because I've gotten people tagging me in like articles of like, you're wrong, look at this article, it says, and I go into the conclusion, just like basic scrolling all the way to the conclusion, and it says, we can't confirm the data, blah blah blah, like we don't have enough evidence. And I'll like screenshot it, send them to them, and I get blocked. I've gotten blocked already a couple times.
Yeah.
I'm like,
I love it. So good. That's so good. So yeah, is there any other ways we can make money? Rob and I can make money in the future with like Pseudoscience. You got anything? Just checking. If that's it, that's fine. I just want to make sure, any way for we can write it down.
Or any way that we can avoid getting sued after we break somebody's neck with these.
Yeah, like I want like any of the words that we can use, because like you want to like increase vitality and stuff. Like you don't want to say anything that will get you sued. But like if I increase your vigor, like that's nothing. That's nonsense.
How do you prove that?
Tell your patients to buy a $200 fiber supplement that has 5 grams of fiber, and tell them it's miracle.
just rip off unicity.
And just tell them, oh my god, this is an amazing fat burning tool.
Oh, it's so good. I love it.
I think that is like the pinnacle of chiropractic. I think
the supplements really and that's true like any kind of professions. It comes back to supplements because it's just so easy to profit off it, and the margins are so large compared to anything else.
I'd say the best takeaway is if someone has the necessary education, it just gives them a little bit more trust. But if they are not backing up anything with data, because you can be a doctor of whatever, and even if it's in your field, if you are not using the data that is current, that supports your whatever you're trying to talk about, then you're a quack, my guy. Like it's it's common sense. Like I don't even feel massive comfortable still talking about nutrition because it's massively complex. It's very complex, especially when it comes to like the functional medicine side. Dude, I have to like verify interactions with the medication the person is taking with the things that I want to lower and help, and then it's a lot. Mm-hmm. So whenever I hear stop taking your medication, which is illegal for a chiropractor to tell someone that, so that's a way you can sue someone. And you say, hey, take this supplement, it's gonna help you with this. Oh yeah, but I'm taking Xanax, I'm taking levothyroxine, I'm taking all this medication who are like very high contraindications. I'm like, nah, it's okay, it's natural. I'm like, dude, you chug 5 liters of water, you're ending in the hospital. Water's natural. What the hell?
Yeah.
Exactly. So, I mean, do you two have any? I like to leave people with something like actually good and decent advice. So, do you just have any like general recommendations for people so that I don't know, like they have to see you less? Which I understand that's a terrible thing to tell people. You want to tell them the horrible advice so they have to come see you more. But like, what advice would you? Just general advice for just kind of being healthy and within your kind of scope of practice, obviously.
The way we practice is essentially depending on the goals of the person, and I think that's where every chiropractor and physical therapist, right, we're pretty similar. It should be around the person's goal. Like if your goal is to get out of pain, well, will probably be depending on what the issue is. It could be a month, it could be 2 months. It's everyone's different. I can't tell you, you're gonna be here with me 3 months. Like I don't know, you can be well in 2 days. So it's a lot of communication. It's a lot of understanding the end goal of the patient. Some of the times they're like, most of the time our patients, they kind of want to stay because they want to continue with like the rehabilitation. They want to do more of the strength and conditioning stuff. I have people who want to stay with me for like I have one particular patient, she has depression, like a major disorder depression, and she's working with her psychiatrist. I'm working with her psychiatrist as well from the natural side, and we're kind of mixing and matching what's the best course of action. And she's been with me for a while, so it's not lying to the person. It's they're gonna stay with you if they trust you,
and if you're honest,
if they will stay. There's people who will stay a month for the pain management thing. They will dip. Cool. Like we did our job. So it's really finding someone that will be very sincere, because there is a lot of psychology also involved.
And it's like putting your ego aside. Like we're there for the patients to make people feel better. Not, I mean, if I become a millionaire, good. If not, then I'm okay. I was helping people. But the thing that I always tell patients is that, first of all, I don't have to adjust you all the time. That's just for you to feel good and for me to do other stuff. Now, when it comes to exercise, yes, I do want you to exercise, like mobility and, staying
Right.
mobile, strength and conditioning, all that. That's the most important thing, and that's a huge predictor for you to age well and be resilient. And my job is to teach people how to be resilient. And I'm still gonna be here, like if they need me, because we're
cheerleader
humans.
in, in the fight.
Yeah, and we're humans. We do stupid things. We hit our little toe all the time, and I'll be there when if you need me,
Okay,
and I'm gonna help you. But that's the main thing. So we teach all our patients, everything is moderation, but the most important thing is keep mobile and keep that strength going on. So
that was a good plug, and you didn't even notice.
Good
really?
plug.
The podcast called In Moderation.
Oh. Nice. I was inspired.
So 2 hours before we got on with you, my dad was in a big car crash.
Oh.
What should I be looking for to find him chiropractors like you guys?
I was going to ask, I was like, what are some,
Wait,
the next thing I was going to say was like, what are some good things to look for, and what are some red flags?
That's my first question. Is he okay? Like, is he stable?
He's stable.
Mm-hmm.
Okay.
That's as much as I know right now. Like my sister's, they was on the way to his brother's, which passes through a lot of empty farmland. So it was literally in the middle of nowhere. They're trying to call me, and it kept.
Oh no.
So when he looks for a chiropractor, what are some red flags, and what are some things he should look for?
What are the flags?
Number one, do not go to a pit mill. So that would be a personal injury clinic that they only do personal injury, because those people, they usually work directly with lawyers, and all they're looking is to get money out of the insurance. So they're trying to bill and bill and bill, so they're able to get more money. So I would say go to more of a local type of practice, one that is heavy in rehabilitation, that does other therapies besides the adjustment, and that their main focus is not personal injury, or that they just do the adjustment. They have to do rehabilitation.
Okay.
Yeah, either a sports chiropractor or a chiropractic neurologist, because chiropractic neurologists are training how to do concussion rehabilitation and all that. So either of those will be the best ones. Red flag number one will be, red flag number two will be if they only do adjustments, like you said. If they try, if it's a chain. Yeah, that's a huge red flag. Like, don't go to a chain, because that's they're just
like the wellness way stuff.
Wellness way,
pass down.
Yeah, no. I think those will be the most. You're in Canada, right? He's in Canada as well.
Yeah.
I would go to the social media, check out like what they do. That's how we get a lot of our patients, because they see chiropractor and they're like, oh no, this is another chiropractor. But then they go to our social media and they see that we do a lot of rehab, nutrition. I barely post anything of adjustment. First of all, because because I'm not a huge fan of posting my patients in social media. I do a couple because they say like, oh yeah, post me, but I don't like it. That's
I know
one.
that feeling. I don't like posting my clients.
And I feel that social media should be more educational, and for patients to see what we actually do and confirm like, oh, they are cool, let me go to them.
Anyone can crack a neck.
We're trained.
I mean, I can do it. It probably won't go well, but like I can make it happen.
Well, Liam, you want to try me?
But I was
now In Moderation is hosted by one individual now.
You just get the Dinger device.
Oh,
you'll be fine.
man.
Just tie to a door and go like and throw yourself.
Listen, Rob, don't worry. I'm
I
not
don't
going to
think
just
that's
get
a
a
good idea.
towel. I'm not some kind of hack that's only just going to use a bathroom towel. I'm going to make sure I get the real
Yes.
Nike type device,
Yes.
you know, the name brand.
Wow.
He's giving
Nike
me
comes out with their own
special
line.
treatment.
Oh my god.
I'll find out what you're deficient in as well. Hey, can you hold this? Yes, you can. You need potassium.
Yep.
Look at that. You're holding it right there.
You know what? He needs bananas because I know that Rob doesn't
And
like
he needs
bananas.
That's what I was hoping for.
No, I'm out. I'm out.
Rob hates bananas so much. I try to always bring it back to his.
Yeah,
to
I
eat
saw a
bananas when I
video.
can.
I saw a video, like an old video of you guys talking, like yesterday. Like it randomly came up, and I was like, "Oh, I don't like bananas." Like I'm gonna throw this in the podcast somehow.
You did your research,
and you had to mention potassium, so it's technically your fault.
We try and bring up every time that people need to exercise and get every person we bring on to say that, and we try and bring up that Rob hates bananas. Those are the two things, so we've hit both of those, so we feel pretty good.
We are completed.
I hate you all.
And then the adjustment helps people with colic.
Yeah.
So we got to find out about the dad. Yeah, answer the phone.
Yeah.
Hopefully he's okay. We will find out momentarily.
Damn, that was really random.
Yeah.
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 Those are scary.
Seriously, you know, like you talk about like the damage, you know, spine's pretty strong, but fucking car crash is stronger. Car crash beats spine a lot of the time.
Most of the time, it beats spine.
I mean, listen, you ever see those videos of like the crash test dummies?
Yeah.
Where they like hit them into the wall and they're just like, I'm just like,
yeah,
no chiropractor's gonna be able to do anything with that. That's
that person needs to go to.
What do you mean? We're just gonna test the potassium.
We're gonna test it. We'll put this on you.
That person,
does that feel warm?
That person is referred to the funeral home. Sadly.
Oh yeah.
That's
a red flag. If a chiropractor has deals with the next door funeral home, red flag.
Yeah.
Don't go to that chiropractor.
Oh yeah, we had our fair share of crazy people in our profession.
And I mean, like every profession has that. Like, you know, Dr. Gundry was like a cardiothoracic surgeon, and now he's gone completely off the deep end. People ask me like, but he's a doctor, and I'm like, yeah, cool. Every other doctor disagrees with him, and he tells people smoking is healthy. Like, what do you think? Like deep down, what do you actually do? Do you believe this guy? He also sells like every supplement.
For the longest time, we've known that smoking is not good.
Yeah,
and
I mean, like in the 1920s, they called them like coffin nails. Like they weren't. It wasn't even back then. People knew this wasn't good.
Yeah.
And gosh.
And not because you are 4.0, it means that you're the best.
Oh, that is a really good one.
Yeah. We know so many people that they were straight A's and they're the worst.
Yeah, I maybe it's. A lot of those people are very smart, and I don't like if you're getting straight A's, I think we think of like smartness as a whole, like someone's smart, so they're smart at everything. Like they're just like around smart. Whereas like it's more like people are really good at specific things. Yeah. Like you look at like a classic example, like Einstein was very smart when it came to physics, of course, you know, but then like in other aspects, he wasn't so great. He was like, you know, an average person, or wasn't maybe below average. And so like, you know, some of these people, they're great at that. And then maybe they're not great at other things, or maybe they are just really smart and they know how well to sell out and how much money they can make by selling all this extra stuff. Cause that's where the money comes. The money you can make with supplements. Every time I see it, I'm just like, that's insane, man. The profit margin like it costs pennies. It literally costs like pennies to make like you know, and the bottle costs as much as the actual supplement itself.
I know.
Yeah.
And that is one of the issues that I have with, you know, because I practice, you know, I use supplements in my practice whenever generally someone needs it, and I go like, how do people make so much money? Oh yeah, they oversell the patient random ass stuff for no apparent reason.
Like I look at the greens powders are a great example. You know, like athletic greens cost about $100 to $120 per like bag, which is like, I don't know, like 50 servings, something like that. And the margins are insane. What's the deal, Rob? Oh, turn it back. He's unmuting himself.
Not yet. There you go.
Had to find where the unmute was.
Everything okay?
Everything's okay. I have to drive out there tomorrow.
Oh no.
To because his vehicle's completely totaled, and
so
go in his trailer because we were going to a family camping thing. So I have to drive out there, which I was going to drive out there anyway to actually do the camping, but now I'm going to be driving out there with my truck to change the trailer hitch over to mine, and I'll be the one pulling the trailer back.
Right. I mean, but busted car, that's fine. Like you can always get a new vehicle. So
he's good.
Was there anything else, Rob, that you wanted to bring up or anything here? I think we got like almost an hour. Like that's pretty solid. I don't know if there's anything else you wanted to bring up for you two. For Tates and Mike, you guys got anything else you want to?
We got to hit the wellness way, and chiropractic actually makes sense now.
Right. Yeah. I want to get just because I was like I don't understand.
Yeah. I think my big goal from this episode was to be able to come out of it and actually answer somebody's question when they say, should I go to a chiropractor, without just being a blunt no, because everyone on social media sucks.
Yeah.
Right.
Oh yeah.
Oh, guys, I totally forgot. Yes, you're still here. Okay. I wanted to ask you something. I want some good insults that I can send to a chiropractor when I get in a fight with them. Okay. So like, is there like a shitty chiropractic school? They're like, oh, did you go to so-and-so? Like, is there like, is there like, like you don't know your ass from your elbow? Is there an equivalent for chiropractors? Like you probably,
you can say like,
something?
There's like we call it a cult. Actually, it's upper cervical people, and actually Michael is an upper cervical, but he's one of the cool ones. But upper cervical
I got
people,
certified in 3 techniques, so I can talk about it pretty well. I can talk.
If you go and say like, oh, I hurt my big toe. Oh, let me adjust your C1. We'll take care of it. Everything is everything is solved.
C1, like
everything is C1. Yeah.
So
everything's C1. Okay,
they're super philosophical as well.
So if someone comes in and
always C1, never C2.
Yes. I think that's the best
C1.
one.
Yeah.
So if someone says something, they say, "Oh, probably you need your C1 adjusted." That's why.
You can.
That's good.
You can reference the Green Book, the philosophical book.
Oh, the Green Book. You there's something there. Okay, I'll have to think about that, but that's Liam, a good one.
Liam, get yourself a green binder.
Yeah.
Come out on stage with it. According to this, I just need to adjust your C1. Let me just.
There you go.
I mean, that's good for a video. I need something I can hit him in the comments with, just like.
What is this school? Is it Logan? The brown thumb.
Oh,
is it Logan?
Yeah, it's Logan.
Yeah, so
Logan is good though. Logan is a really good one.
But they invented the coccyx adjustment. So you can either do
that's when they need their coccyx adjustment. This is going with a brown thumb.
So you can either do it outside, which is that the one I do if I need to, or you have to go inside because the coccyx is going in. So they have to and pull it out.
And they call it the brown thumb. They nickname it the brown thumb.
Yeah, if a patient needs that, I'm like, nope, I'm referring you out. I'm not going in there. I'm so sorry.
That's interesting. Yeah. I like it. Okay, I got some good insults now. I think I can throw some chiropractors' way. I'm happy.
Just hack me. I can back you up.
Yeah.
What kind of lube would you like for your brown thumb? Oh, that's great.
Yeah.
You wouldn't know a C1 adjustment from a coccyx one without, and then I can work brown thumb into there. There's some good stuff there. I got it.
Yeah,
I'm getting it.
You're not gonna sleep today.
Yeah.
You're gonna get your journal.
I'm gonna think, like you wouldn't know a C1 from a coccyx adjustment.
Liam is gonna have a vision board.
Even if you're brown with thumb.
Even if you,
Oh my God.
You're gonna have the vision board with all the quotes and pictures and everything.
the strings attached to it, I want to listen. If they're gonna scare everyone about fucking, seed oils and everything like that, at least gotta hit them with some shit. Like I gotta have some fun with it.
Yep. Seed oils is always the answer, especially when it lowers the inflammatory markers. Sounds like an awesome plan, my dude.
Yeah.
They are
It's always seed
inflammatory,
oils.
Yeah.
but it decreases your
answer is always seed
ESR
oils.
marker. So that's I think that's awesome.
Oh gosh.
I like debating people with anything like that, and people are sometimes it's just a quick Google search. You don't even have to read the research.
Mm-hmm.
Like sometimes it's just plain there in like the first.
Yeah.
I don't know.
Yeah, but a lot of people get their information from like blogs and shit like that. It's just
From like Mr.
memes.
Smith.
Like,
Mr. Smith from New York wrote a
From
blog.
the wellness way.
yeah, if you have a phone and internet access, you can pretty much say anything, and you can get people to believe you, man. I'll tell you, like it really.
If it's on Facebook, it's real.
Pretty much. There's so much shit.
I think
Anyway.
that pretty much covers the basic understanding of chiropractic medicine,
Yeah.
roughly.
Right. Go outside lane, sell people on minor adjustments that they have to come back to over and over again, and then top it off with some, can you hold this? No? Okay, you need this supplement.
Yeah. I'm going to go, no, I think I'm going with the applied kinesiology?
Yeah.
Is that
Yes.
what
Yeah.
I'm going with
Kinesiology.
that, and then I'm going to sell supplements, and people are always just going to be deficient in what I sell, or whatever's the cheapest. So I'm going to look whatever supplement's the cheapest to make and
Most of
sell,
the time,
and
magnesium.
then people...
Yeah.
Mostly, if it's great. I'm
dope.
going to get the cheapest form of magnesium,
Yeah.
and I'll just say it's the best. And then I will just tell them they're deficient in that, because magnesium is like popular right now. And then I'll just sell them that
And
afterwards.
you can get a hydrogenized water, because water doesn't have hydrogen.
Yeah.
We're selling alpha water now. We've come to this in a few different podcasts. So it's alpha water. I drink it because I ain't no beta bitch is what we've come up with. And so I'm going to sell that as well.
Okay,
That's for sure.
Coming
Make sure
soon.
it has
Coming soon,
multiple
alpha water.
hydrogen
Yeah.
ions. Multiple.
With extra hydrogen. Alpha water with extra hydrogen.
Yeah.
To kind
It's
of,
going to be, just nothing but hydrogen atoms and alpha atoms.
It's so hydrogenated, there's no oxygen
Yeah.
or something. There's like, how about that? Like,
forget
our
lactic
hearts-
acid. Who cares if you have excess? It's like
pure hydrogen. My water is so hydrogen rich, it's just pure hydrogen.
Yeah.
And alpha water, I ain't no beta bitch. And
H
I'm
to the
telling you,
max.
I could sell that, and it's just be a can of hydrogen. That's all it is.
just
There's
have like one of those big chuck dispensers, like the Prima filters, and just put that water and just say, this cures everything.
Yeah. But make sure it has a light under, so
Yeah, make
looks
it into
cooler.
make it into a red light. So
Yeah.
it's like more fancy.
God.
I'm giving you all the hacks. I don't know why you're not doing money yet. Like, I don't know why you're doing, man.
We're waiting until we've got all of them combined.
We gotta get all the
into one
pieces.
Super.
Yeah, why get a
Right.
$5
Nobody will
blood
ever-
work in magnesium just to check it out when you can just test it with a random $5, my dude. That's all it takes. It's not that crazy.
Yeah.
Basic.
And this
Oh,
hydrogen is so powerful, you could fill a balloon with it. When has that ever gone poorly? Buy now.
Listen, I've had people try to sell me you know, because
yeah, the
you know
hydrogenated water.
they see me as a chiropractor.
Oh, yeah.
They think I'm into all this crap, and they will like go like, dude, you need to have this for your patients.
If you
it's
don't drink
hydrogenated water,
if you don't drink it, you're gonna get osteoarthritis.
dude. I had to share this because this is awesome for the podcast. Wait a minute. Wait, let me get comfortable.
Wait.
So,
He's getting comfortable. Oh.
look at this. I got invited into this random Zoom call at 8 at night because it was like a random like health and stuff. It was like, I'm all for learning. I'm a nerd. Cool. Logged in. Crazy lady starts talking about like how she was like, she couldn't walk, she couldn't do anything, and her doctor diagnosed her with osteoarthritis. Wow, what a debilitating, horrible disease. Okay, it's early stages. It's not debilitating, ma'am. It's not how it works. So, fun fact, she just says that she started drinking this water and she was better because she was detoxifying her life.
Of course.
Yeah.
And me as the doctor, when they say, hey, anyone has a question, and I go, do you have a human randomized control trial you can send me? And she goes, I have some research I can. She sends me a random pamphlet made in Canva.com, and I'm like, this is not a research, it's a random pamphlet. And then it's like, no, there's some research in the like whatever. But no, there's nothing. So I started digging in, and I found this only one article about this specific product, and it had positive effects. But you know why it had positive effects? It was not hydrogenated water. It was spring mineral water, and the people who were drinking were deficient in the minerals inside the water, so they felt better. Yep.
But for most people, a pamphlet is really all you need.
Yeah.
Like that's probably more than what you need.
Oh,
You
yeah.
probably don't even need the pamphlet. But for like the naysayers, give them a pamphlet and you're all set.
Like, oh my god, water. It has hydrogen. Wow.
Yeah.
Elementary chemistry.
Yeah.
Like,
Ah.
I don't know. So that's
Well.
I wanted to share that with you guys because
Yeah.
I know you were gonna like that.
But some shirtless guy in a grocery store told me otherwise, and he's shirtless in a grocery store. He's got
and he's
Yeah.
beefed up, so
Yeah.
he knows.
You always have to
Listen.
believe the beefed up guy.
Listen, we'll have the affiliate codes for all of these things when we sell out, and you guys can join, and then you can just be one of every other chiropractor that has decided to sell out and make money.
There you go.
Reasons why we're trying to change or add into our careers.
Yeah.
Because damn.
Okay.
Did we get their info while I was gone?
Oh, yeah, we got to do that.
Oh.
Hey. Where can people find you on the social medias?
So you can
Social
find
medias.
us by Move Forward Chiro. That's like our practice social media. That's in Instagram, TikTok, Facebook, and then
So that's practice moving forward. Got it.
yeah. And then Michael also has your gaming chiropractor. That's where
I rant.
he rants.
Yep.
Yeah.
Oh, okay. I just assumed it was where you like tried to crack people with your butt while you're
Yeah.
steering a game, getting angry. That's why you're getting angry, isn't it?
Yeah.
It's because like
Everything
they're not
hurts.
settling down. They're trying to move too much. It's throwing off
Yeah.
your game,
I
and
need,
you're just like,
I need a
stop moving.
I need a brown thumb. I need a brown thumb adjustment. That's what I need.
Yeah.
I have solved the issue. Every one of my social media outlets is a ranting outlet. That's all I do. So it works
is.
perfectly.
It is. It's all he does.
But yeah, if anyone ever needs us, we're in Tampa.
Yeah, we're in Tampa.
Hey, wasn't that a great time listening to the podcast? You were just, I'm assuming you were just listening to In Moderation. So if you go ahead and hit the 5-star button, is that a thing? The like button?
That's a thing.
No.
Yep.
The like button
5
on
stars.
YouTube. If you're on YouTube, hit the like button. Not the dislike button. That's a bad button. The
Bad
like
button.
button.
Don't touch.
Hit all the other buttons. The share. You can go check out
all those things.
subscribe. Go check out our Patreon. We do have a Patreon. It's free to join if you want, or you could give us some money. That'd be really cool, like $1 or $2. It doesn't matter. Whatever you have.
That's where you'll find all the news for this.
We're super appreciative. You can find all sorts of other stuff there. We do giveaways, I think, sometimes,
Sometimes.
all that good stuff. Yeah, absolutely. So Peace.